Hi there, I'm Dr. Benfield. I'm a GP and this video looks at the National Asthma Guidelines using a single combination inhaler for anyone over the age of 12 years old to improve their asthma symptoms and reduce their risk of having severe asthma attacks. There are two slightly different versions of this regime, and the first is called SMART, Single Maintenance and Reliever Therapy. Now, the old regime was to have the brown inhaler twice a day to control the asthma. That's your maintenance bit. And the blue salbutamol Ventolin inhaler, when you have symptoms, that's the reliever bit. Now, because Symbicort and Foster, these combination inhalers, contain both the steroid medication and a version of the blue inhaler that works exactly the same speed as the blue inhaler, you can have one single combination inhaler as your twice a day asthma controller instead of the brown inhaler, and you can also have the same inhaler for your relief of symptoms instead of the blue one. Now, the massive benefit of this is that if you need to use your blue inhaler, it must be because your asthma is not well enough controlled. The blue inhaler will mask your symptoms for a short period, a few hours, but does not improve your underlying asthma. The biggest risk here is if your asthma worsened, using more blue inhaler does not stop the worsening, and it does not reduce your risk of developing a severe asthma attack. With the SMART regime, you will use the combination inhaler morning and evening for asthma control. If your asthma is not well enough controlled and you need some relief, by using the combination inhaler again, it will give you instant relief, and it will also give you extra steroid to control the asthma. This means that when your asthma is controlled, your steroid level will be low. As your asthma starts to worsen, your steroid use will immediately increase with it, and that should get the asthma control quickly again. Now, you might be thinking, I don't want to take that extra steroid. Now, the good news is that in the large trials looking at using this regime, the amount of steroid absorbed by people on the new regime was 25% lower than using the old regime. And that's because fewer people needed to use steroid tablets for asthma attacks. The amount of steroid that's absorbed into your body from needing tablets is massive compared to the amount that's absorbed from the inhalers. You want to make sure you have two of these inhalers prescribed, because you would keep one in the same place for the regular use, such as by your bed or where you brush your teeth, and you carry the other one with you instead of the blue inhaler. Now, the other version of this regime is for people who only have a blue inhaler or have a brown inhaler but rarely use it, or maybe just use it for very short periods. If this is you, then you continue to do exactly the same things, but using the combination inhaler instead of the brown and the blue inhalers. So if you notice symptoms, you use your combination inhaler when required instead of the blue one. If you're needing your inhaler a few times a week, you start having a regular dose, using it a puff in the morning and a puff at night, and extra whenever you felt like you needed to use it. Please speak to your doctor or an asthma nurse before changing to the single inhaler regime, as you will need some advice tailored specifically for you with using this regime, and when you should be contacting for a review if things are worsening. So, for example, with this regime, the extra steroid you use with the relief should improve your asthma symptoms, and if after a few weeks you're not finding you're using it any less, you'll need a review. Okay, thank you for watching. In the next video, I'm going to talk about having an asthma plan for when things worsen despite the regime.